Maximum Health with your host, Dr. Ken Gray. With over 20 years in healthcare, Dr. Gray is a doctor of Oriental medicine and holistic physician fusing Eastern and Western healing. Dr. Gray is on staff at Jupiter Medical Center and in private practice with an office in Jupiter, Florida, where he resides. Dr. Gray enjoys being a physician as well as being an educator. His unique approach to holistic healing has taken him abroad to lecture in Baden-Baden, Germany, and treat sports professionals in Hawaii and Biarritz, France. He is co-author of several books on food therapy and the founder of the annual Star Summit Talks at the Norton Museum of Art in Palm Beach, Florida. Now it's time for Maximum Health with Dr. Ken Gray.
Welcome back, everyone. This is Maximum Health Radio. Thank you for joining us. We have today in the studio with us Susie Gurfein. Just a true pleasure, a psychotherapist that also specializes in EMDR and trauma. And I think it's just something that I'm so intrigued about, you know, how the two, just the history of psychotherapy and this therapy of EMDR are coming together, and how you've been able to help people with trauma. And I'm sure people out there now who have experienced trauma from either childhood or currently in the state of things, you know, the general emotion. It seems like I keep hearing from my patients, you know, the world is so in chaos, and there's this perception of constant living in trauma, right?
Right.
So it doesn't always have to be the things that happened to us a long time ago. It can
be something that's happened currently.
Yeah.
But thank you for having me. This is a pleasure.
You. Yeah.
Well, to begin with, I became familiar with EMDR therapy a very long time ago. I was fortunate enough to have my own therapist that was helping me work through things. And she was trained in EMDR therapy. So after a while, I realized how much it had helped me shift the responses, the emotional responses that I was having to certain things. And that's when I decided I should be trained so I could help, you know, my clients better in many ways.
Yeah. Tell me, so we can just break it down for our listeners, what are the initial or basic skills or skill sets of a psychotherapist, so that we can understand why you then went on to augment and implement EMDR?
Well, psychotherapist is, it deals with all different types of modality, from cognitive behavioral therapy to psychodynamic. So there's lots of different modalities that a psychotherapist has to offer a client. Supportive therapy, you know, all of those types of things, depending on what the needs of the clients are when they come in. So EMDR stands for Eye Movement Desensitization Reprocessing, which sounds like a lot of crazy things put together. But what it really does is, when we have trauma or an experience that has had a significant emotional effect on us, and it hasn't been processed properly, it gets stuck in our brain. And so what happens is that in everyday life, if a situation comes about and it's even remotely familiar, whether it's a sound, it could be a smell, it could be many things, now you're having an emotional response that doesn't correlate with the situation. And you feel the exact emotion that you felt back when you had the experience. So it's a good way to kind of explain this is it's based on a bilateral stimulation of the brain. And when you're sleeping, you know, you have REM, and that's the eye movement that goes back and forth, and that's the bilateral.
Right.
So the conscious mind is asleep. So the unconscious comes up. And what doesn't happen is, because there's so many things coming up, memories and everything coming up at once, the brain can't release any one thing. So with EMDR, we pick, well, first of all, when a client comes in, it's very important for me to do an in-depth history.
Okay.
So I understand, you know, all of what's going on with them. I also try to understand what is happening to them presently that's causing them the distress and what's not working for them in their life.
So there's always what they perceive is happening to them versus what is.
Exactly. Okay. And so part of my job is to help connect dots so things make sense. Because oftentimes we don't have an answer as to why we're reacting the way we're reacting.
Right.
Because what's happening today doesn't correlate.
Right.
So, but I also make sure that I develop a rapport with my clients, and so that they feel that they're in a safe environment. And that takes a couple of sessions, because they really need to know I understand.
And they're in charge.
And it gives me a chance to explain how the whole process works, and they just get to know me and hopefully feel comfortable and safe. And so EMDR, I'll take a history, I'll find out traumas, experiences, whatever I can get them to talk about at the time. And sometimes it takes a couple of sessions to get them to talk about it. And then, so the EMDR is based on the theory that you pick a target memory. And it doesn't have to be the worst memory, but a target memory. And we discuss the memory a little bit. And then I hand them a list of negative beliefs that they possibly could have about themselves today, because of that experience. And so I ask them as they read it, what resonates with them, tell me what it is. And it's a long list. It's I'm not good enough, I'm worthless, I'm not lovable, I should have done something, I'm not capable. It goes on and on and on. Not all of them, they resonate with, but the ones that they do is an important part because that's what they're dealing with.
Right.
So then I use, EMDR can be done a couple of ways. You can do it by having a client watch your fingers go back and forth, tapping. But for me, I find what works the best is these handheld little vibrators that go back and forth. And I can adjust it for them so that it's not too strong, that it's distracting them, and it's not so weak that they're looking for it.
Okay.
It's just got to be in the background. So then, I let them feel it so they're comfortable with it. And then I'll say to them, so now take a deep breath, close your eyes, bring up the target memory, the negative beliefs, and then just let your mind go where it needs to go. So I explained to them that sometimes it can start with the target memory, but it may take you someplace that doesn't make sense. And wherever it takes you means that needs to be cleared. There's something there that needs to be cleared.
While you're talking about it, it almost reminds me of a magic trick. Where, you're doing this with the left hand and you're dazzling them and they're so, and then everything else actually is really going on in the right hand.
Exactly. Well,
and next thing you know, you have this great magic trick,
that.
Right? So no, that's wonderful.
And so, of course, I watch their body language.
Yeah.
Sometimes it can be very emotional, but I watch their body language. I watch their breathing and make sure that they're not in any distress.
Yeah.
And I generally stop it in about 60 seconds.
Now, in these cases, would you say 50%, or I don't know if you can quantify, but how many times does distress happen? Is it most of the time?
I think it depends on the trauma.
Yeah. I'm just saying an average.
I'd say, distress meaning they become tearful.
Yeah.
I don't think it I have not seen.
It's not panic.
It's not panic.
It's tearful. It's emotional. It's connection.
Correct.
Yeah.
They're
okay.
connecting with
good.
it, which for me, because some clients are very resistant and they can't get down to that memory, and they'll say, I'm not seeing anything, which is not unusual. It just takes them to relax into it.
It takes time.
Yes.
Yeah, I've seen that too, even with the therapies I do, which is can be a cathartic release systemically and physically. When there's loss, right? You've lost a loved one, you lost a child. I've seen those people, those type of patients come to me for therapy because in their body they experience pain and issues that have been there, and maybe they've done other therapies which have helped them mentally and emotionally, but their physical nature
for sure
has been changed.
Yes, and it does affect you.
By loss or trauma or poor marriage situation, marital situations. So you do see that release, that another level of release, that on the table to start crying. And they're so grateful for it because, immediately, I'm sure listeners, if they haven't experienced it, may think, oh, I don't want to be that emotional. I don't want to go there. But you don't know until you've gone there how beautiful and how helpful that can be. I heard a saying the other day that when you cry, you allow the liver to release stress and toxins. It's actually the liver. It's because the liver opens to the eyes in Eastern medicine, so it makes sense. There's this level of release for that organ, which is a very stress relating and hormone relating organ.
Yeah, and I have a lot of men that come in, and as well as women, and again, like you said, a lot of men don't want to get down there and get emotional.
Yeah, very much a psychological, social, cultural thing.
Oh, for sure.
Right?
But yet, I do see that when we start it, they become tearful, and then when I stop it after 60 seconds, they're like, I just never knew how painful that was for me.
Right.
Never knew.
And you helped them so much. Yeah.
And so things start to make sense for them as we go on as to why they're having trouble in their daily life.
Yeah.
A lot of it has to do with their belief system.
Right.
The negative belief system.
Yes.
So we'll continue.
Touches everything.
It touches everything. So we'll continue to do that for 3 or 4 rounds. And I'll just, wherever they stop the first round, I'll say, you know what, go back to that, where your mind took you, and let's see where it goes from there. And so we keep doing it, and it goes to very interesting places. It doesn't mean it's going to, open up like a traumatic memory you've suppressed. It doesn't do that. So it's...
Because you don't want that all the time.
No.
That could be an explosive sort of just create chaos and almost like a Pandora's box effect.
For sure.
Right.
And that's not what this is meant to do.
Right.
It's to help people understand or make sense of where their stumbling blocks are and why they can't get past it, even in business.
Or use them.
Right. Even in business where they can't get past a certain point or and 9 times out of 10, it's a negative belief system that they've had since mostly childhood.
Right.
And because when we're young, there's a great theorist called Erik Erikson, and his theory was that we all go through psychosocial developmental stages from birth to death.
Okay.
And in each stage, from infancy on, we're meant to answer certain questions about ourselves. And that's how we start to develop who we are in our sense of self. So one stage is, can I trust? And if the child's needs are being met. Am I lovable? Well, depends on how the caretaker is taking care of them. Am I good or am I bad? All of these different stages, we answer these questions according to how we have been treated.
Right.
And if it's not nurturing, then we answer it wrong. So what we end up doing, because when we're young, we have to minimize it and make it not so bad to survive it. So that's where it stays. Like it's not a big deal.
Right.
And then we go off into the world as an adapted self instead of our authentic self.
Wow.
So
you lose a little bit along the way, just a little bit, but just a little bit becomes a lot over time.
That's your belief system.
Yeah.
That's how you make choices, you make decisions because of those negative beliefs. So we'll, at the end of the session, I help them process and talk about it, ask them how they're feeling. And then, I always, which is part of the EMDR, when you're reprocessing the negative, the buzzers go back and forth very rapidly. When you're installing something positive, the bilateral is very slow. So I will use tapping on their knees. So what I ask them to do is to think of a safe place, meaning place maybe they've been to or with somebody that they trust,
Yeah.
or it could be very general. And when they can come up with what that is, I said, I want you to make sure that this is the place for you.
Right.
So they'll bring that up, and then I'll tell them to take some nice deep cleansing breaths and to really feel it. And I'll start tapping on their knees slowly, and I'll kind of give them some direction, meaning, I want you to see yourself with a smile on your face and a peacefulness, a sense of joy, a sense of safety. Maybe feel the wind, maybe feel the sun on your face. And I just keep tapping as they're doing it. And so we do that for a bit, and I'll say, try to notice other things that are making you smile.
Mm-hmm.
So after we do that, I explain to them that this is a coping skill for them now. That when they're in their everyday life, when they find themselves having a stressful response, whether it's fear or anger or anxiety, anything, they can just take a minute and close their eyes and tap back and forth on their knees. Or I also recommend they wrap their arms around themselves and tap on either side very slowly and bring up the memory, and then until you start to feel the negative response start to calm down. And it happens to be a really excellent coping skill that they can take with them wherever they go.
What does EMDR stand for again?
Eye movement desensitization reprocessing.
So yeah, there's definitely I was thinking that it's got to be reprogramming or re something in there.
Reprocessing, yeah, because the trauma or whatever the situation was never properly processed.
Right. I yesterday it was funny. I have a colleague, and he's a clinical psychologist, and he says, so how are you? And I said to him jokingly, I don't know. I'm not qualified to answer that question. I said, that is outside of my scope.
For sure.
So, and he laughed, and he says, it's funny. You put two psychologists walking down the street, and, one says to the other one, how are you? He says, I don't know. How am I, So that leads me to the question with you.
Mm-hmm.
There was something that drew you to add this to your repertoire, your toolbox, your superhero powers.
Well, as I said at the beginning, it was something that I personally experienced.
Right. So
when I was going through a very difficult time.
Right.
And I saw how much it helped me.
Okay.
And so that was a catalyst
Yeah.
for me to bring that into my practice, to add another modality
Right.
that could help clients that, are really in that stressful place, that sometimes talk therapy, you can't get to the trauma.
Mm-hmm, mm-hmm, mm-hmm.
And the other thing I make sure I explain at the end of the session is that once we hit that target memory and we have started the bilateral stimulation, it's working. It's already reprocessing without you knowing it.
Right.
And what happens is when you leave the office, it keeps working because you're walking. And that's a bilateral stimulation of the brain.
Okay.
And so it's not like, I make sure I explain to my clients, it's not like you're going to wake up one day and you're going to have this epiphany and everything's going to be great.
Okay.
It doesn't work like that. But you will see over time, as we continue the EMDR and we continue our talk therapy, that something that once caused you to have an emotional response that was distressing, all of a sudden you'll realize that you're not feeling that anymore. And it's subtleties. And after a while, you'll be able to see that I'm thinking differently about my decision making. I'm looking at it, whether it's a block in a business situation, I'm thinking about it differently. Mm-hmm. And I'm not having the negative beliefs about myself like I used to have. So it works in that way. It's just a subtle changes, but you start to feel the physical response be less, and the emotional response be less.
What are some of those indicators for people to walk through your door? What should they be looking for? So you talk about physical responses. So I'm sure there's a list of them, and some that are more impressing upon a person's consciousness than others. So
well,
what would be
I think
those?
it's the emotional response that obviously that causes the body response.
Okay.
So, when they're having an emotional response, they're feeling a tightness in their chest.
Okay, so that's one. Tightness in the chest
Tightness
is
in
one.
the chest. There's a tightness in their solar plexus.
Right. And obviously, we're not suggesting that to our listeners that if you're feeling a tightness in your chest, you should also investigate whether or not you're having a heart attack.
Right,
but,
for sure.
But this can be, if you've ruled out heart attack, the tightness, constant.
You're also tapping into why am I emotionally responding the way I'm responding.
Okay. High blood pressure, sometimes, even if you're maybe on medication, sometimes you can have that sort of high blood pressure response.
Response.
But again, separate from a diagnosis status.
What the reason that a lot of people will start to come in is because they cannot handle how their life is going.
Got it.
And they can't figure out why they're angry, why they are crying all the time.
Why they keep getting into the same relationships?
Why they keep repeating a pattern.
Okay.
And why they think so little of themselves, why they have self-loathing. And all of that has a tremendous impact on the quality of their life.
Right.
And they're not happy with the quality.
Because they seem stuck. And,
they are
years
stuck.
go by, decades go by, and they're like, oh.
Yep.
Yeah.
And they are stuck.
Yeah.
And it's, not everybody knows about EMDR when they come in.
Right.
But, once I understand, and I take the history, and I then start to introduce them to the possibility of the therapy. And, I always ask them, is this something you might be interested in? It works very well on this kind of situation.
Yeah.
It's not something I say, okay, we have to do this.
Right. No, it's just an option.
It's an option.
Because you have some wonderful stories of success. So give us one or two.
Let's see. I had a gentleman that came in, and he was having difficulty being motivated in his work. He was good at what he did, but he had no motivation. And he had anger issues. And so we started to do the history. We started to go back into childhood. And what ended up coming up for him was the way his father treated him and the way he was meant to feel about himself, like that he wasn't good enough, that nothing he ever did was measuring up. His father walking out on them, so he had abandonment issues. And so for him, even though he was good at what he did, he didn't believe in himself enough to really go where he needed to go. And it was through the therapy, I could see him right now walk back in the door after we'd worked on it for a while with this different energy in him, this calm energy. And he would sit down and say, you are not going to believe this. You are not going to believe I just made the biggest sale I've ever made in my life because I believed in myself. Those negative beliefs are not there anymore. And he said, I'm calmer at home. I understand now where my anger's coming from. I think about what I'm going to say or how I'm going to respond to my children before I do it, knowing how my parents' response to me impacted me. So it's psychoeducational as well. That gives them the understanding that I have control over this. They just don't know how. They have control over it.
And how about maybe a female story about relationships?
Well, I had a young lady, a young girl that came in, and she wanted to understand why she was so anxious all the time. Her anxiety was taking the best of her. She was struggling to study for her dental exams, all of this kind of stuff. And we went through significant history taking. And as it turns out, she admits to me that she had, in college, had been gang raped, but she didn't remember it. And so when she started to talk to me, she kept saying to me, you know, it must have been my fault because I must have drank too much. I must have, you know, for me to pass out like that, you know, that's on me. And so she had all of these self-loathing feelings about herself. And then we talked about it some more. And I said, have you ever entertained this thought that a drug was put in your drink? And that's why you don't remember?
Right.
But you remember afterwards the situation that you were in? And like her face just absolutely lit up. She was like, I never thought that that was possible. And it shifted her completely. And she felt better about herself. She got herself into dental school, and we still work together.
Because she let go of the ownership of that
That's right.
happening. She thought up until that
thought it
point
was her fault.
that she put herself in that position.
Correct.
Wow. And every decision after that was made under those...
Yes, those negative beliefs she now had about herself, which we had to, you know, reprocess.
Sure. So you give your... This is great. This is a wonderful instrument tool. It's, you know, I could see why you're so happy about adding it to your practice and seeing how it's helping people.
Yes, I mean, that's the main thing, you know, to see people actually feel better and their lives are changing and they're happier and healthier.
Yeah.
That's the goal, and this is a great tool.
Well, this was psychotherapist Susie Gurfein. What a great show. Thank you for sharing all this with us, and I hope that people that can access you can search you out. I'm not sure if you're doing virtual or what have you, but maybe you can share that information with our listeners.
Sure. I can do virtual, but I'd like to start it in person.
Sure.
First.
And how do they find you?
I have a private phone number that I can give out. It's 561-866-7733.
Not too private anymore.
No, that's okay.
And a website or anything?
Not
or social
yet.
media? No.
No.
So
not yet.
more of a private. And
It's more
you know,
private. Yeah, I like it like that.
It's good.
Yeah. Thank you so much for having me. This was a great show and a great honor.
Thank you. And this has been brought and supported by Vel Health, velhealth.com for wellness within reach. Download it today for all your holistic needs, and we will see you next time.